Oh, hey, Elva, how are you?
Hi, Melissa. How are you?
Welcome to another episode of the cycle.
I know. When was it? Was it Christmas? Before Christmas?
Yeah.
I think we last spoke.
And now we are
New year.
recording for Endometriosis Awareness Month. And this episode is going to be just kind of all over the place. So stick with us. We did not structure it because we both have been going through some things and we're going to discuss that. And we're going to discuss, things that we wish people knew for Endometriosis Awareness Month. And I think a lot of what Elva and I have been going through for the past 6 to 8 weeks are things we wish we knew people knew about going through endometriosis.
Yeah, for
So
sure. I mean, it's been a funny time. I think it's just, well, it's not really coincidental. I think we've learned that we're two halves of the same body on two different continents. We've said it before because we seem to kind of end up with similar issues around the same time. But yeah, we've both obviously been through some, yeah, whatever you want to call recurring issues or symptoms and stuff like that. And so we've both had to jump back into that appointments and chasing and doctor stalking, for want of a perfect
yeah,
phrase, which is really difficult and has taken me years to, and I still haven't mastered. So that was one of the things I thought today is to talk about is, there's no right way to do it, but just to be aware. And for the big thing for me, I mentioned to you during the week when we spoke, was just having that confidence, which it's taken me a few years to build. I'd be
yeah,
a really quite confident person to challenge something in the workplace, but when you come up against sometimes experts in a medical field, I think just sometimes we bow down a little bit and just take answers and take kind of delay tactics too easily.
yeah. I think that's one of the biggest things. And I'm glad that we're talking about it on the show today because I don't think it's talked about very often. And for people who don't have chronic illness or aren't going through endometriosis, they really have no idea the effort that needs to be put in just to get some answers. I mean, it's calls, it's emails, it's trying to schedule scans if you're lucky enough to even have the opportunity to be able to do that. But these things they can take hours, weeks. I've talked to some people in Canada who have to wait months and years to even get into the appointment. Same in the UK.
Mm-hmm.
Recently talked to someone in South Africa who also struggled to just even get an appointment or be seen by somebody. And sometimes you're in acute pain or a critical situation, and it's just how do you navigate that? And like you said, I mean, you have to, unfortunately, even if you're feeling sick, like you have to fight your way up the mountain essentially to get answers.
Yeah, and you know what's really interesting, because and it's you're right. And look, I've always been honest here when I'm talking to you that I'm in a position where I'm within a private system in Ireland, and I lived in the UK for many years, and I kind of saw both sides there. But there is a public system in Ireland, and people wait years, and they are still waiting years. And endometriosis had quite a bit of great press coverage recently on radio and stuff, because I think family members of a TD, which is like an MP in the UK for anyone listening there, or your, oh God, is it like senators? I don't know, anyway, government officials, right?
Okay. Yep.
But again, you get someone like that on the radio who just, what she really covered was her sister's own struggle. But she really keyed in on not just the wait time, but within that wait time, a lot of the gaslighting. And I mean,
Yes.
medical gaslighting is a thing for a lot of people and for a lot of conditions, but it's a really difficult one with endo. And one of the things that we talk about a lot, Melissa, is because a lot of what happens as well is when you're chasing within a system and you're trying to get help, because of the flare nature of this, you can go in and out of really good and bad times. And often what
Yes.
happens is that you're chasing something, you're trying to get yourself up a ladder, up a visit list, and then someone might call back. And I don't know about you, but sometimes in some systems they ask you, how are you feeling right now? Because I guess they're
Mhm.
trying to monitor where can they fit you in. And unfortunately, if you're one of those people who wants to be honest and you say, well, actually I'm better, that passed, like that was 2 3 weeks ago.
Mhm.
And I've learned that I wouldn't say I tell lies, far from it, but you have to be really good at kind of almost not admitting to that, because the person on the phone is not going to understand that for you this might be that you're back in a good week and you're no longer taking strong painkillers, but tomorrow
Right.
you could wake up and you're right back in it again. So that's one thing for me is having, and that's all back to that confidence thing, right? Like, what what does it mean to be confident to advocate kind of for yourself? It probably to a lot of people looks like pushiness and bossiness and whatever description you want to use, and that doesn't really come naturally to me. And you've got to build thick skin. So that's one of these things I want to talk about today, is to say, you're the only person who's going to do it. And you kind of have to navigate personalities as well. Try and read the person you're speaking to. Try and be compassionate, though. I mean, you can be a nice person, you don't have to be a pain in the ass. But yeah, I think you've really got to push it and say, remind them of how difficult things are, and just see what you can do. Because I think if you play the thing of thank you very much, being too kind.
Right. Oh, I'm so sorry to bother you again. You have to be assertive. And I'm very much like you, where I emailed last week, so I don't want to email the doctor again, or I don't want to call again. I feel bad. They're probably busy. You can't do that anymore. And I agree with you. It's so challenging when you're in and out of flares, right? Because you could be in a really, really bad spot and not be able to get a hold of anyone or not get the care. And then you're feeling better. This happens to me all the time, right? And then you're feeling better, and then it happens again. And I think one of the biggest struggles I have, and I really want to learn more and get more deeply in on this at some point in my life, but it's the fear, it's the anxiety, it's the, oh my gosh, everything's back. I mean, there's so much trauma there from all the experiences we've lived through endo, that I still don't know how to manage that. So for the listeners, and Elva already knows this because we've been going back and forth and supporting each other, but I really had like a rough November, was not feeling well, super nauseous, struggled through the holidays, then started to feel a little bit better, and then started just having really bad pain again. And I thought it was my bowel. So I've had surgery on my bowel. So I was very nervous, but I couldn't get into a doctor. And because of COVID, I wasn't about to go to the hospital, but I was struggling to go to the bathroom. And I thought that I may have had a minor blockage, which was very terrifying to me. And also just put me not in the best mental space, because I was really scared. It was really scared. Going through that the first time was very traumatic. And I didn't know I was going through it until I had the surgery. So I was very terrified, and I couldn't get in to see a doctor for over 3 months. And I even feel bad saying that on the podcast, complaining, because there's people that are waiting years to see a doctor, but I really thought I was in potentially an emergency situation.
You have a team as such, like you have a surgeon, you have a family practice. Like what breaks my heart is for people who are not within even that system. And that's how, like, it's difficult when you're in a system.
Right.
I kind of can't imagine. Sometimes we've talked about it, how difficult it must be if you're kind of just navigating the start of it, or if you move. Because another thing for you guys is, I mean, you can move across the states and still be in the same country, but I mean, moving state to state must be a huge challenge, or navigating a health system state to state.
100%. That's very challenging. But also, my doctor isn't in my state, and I didn't have a family doctor. So it just became very challenging. I ended up finding a family doctor, thank goodness, who's actually been very supportive. And also just found a local. So I'm building a local team, basically, is what is happening. But come to find out, and I don't want to say, oh, it was just a cyst, but I have a very large cyst, and that was kind of just disrupting everything, and it's still there. And just trying to figure out what the next steps are. But yeah, so that, for me, it kind of put me in and this happens often with the ups and downs of endo. And I'm sure people who are listening can relate, but for people who might not have the disease and you're listening for Endometriosis Awareness Month, there's so much of us that go through these ups and downs of just the emotional and mental toll of everything, because you feel okay, then you don't feel okay, then you get this diagnosis of something else is wrong. And, sometimes you can be perceived as like a hypochondriac, or it's all in your head and all of that. And that's just, if you're listening, it's not, and you're totally validated in what you're saying. And for people who may be listening, who are supporters or like loved ones, like, you need to give that person the benefit of the doubt. You have no idea how challenging it is to have a chronic illness. So just something I've been thinking about a lot lately.
No, I think that's a really good point. And look, I've had that kind of recently myself too, where, kind of opening up to one or two people to just say those words, like, I know you guys think I must be is this in my head again or whatever? And so, you know, because recently like I said, I haven't been feeling really great. And I went and saw my doctor in November. And like that, I'm in a private system. But even from then, I waited until early February to get a CT scan through. Now, there was some other complications with hospital information systems, but essentially, yeah, you're like, I don't know why. It for sure was not an urgent case on that day in November. But you know, you're in pain, and he's sitting there saying, oh, you know what, we thought we'd kind of knock this on the head for you for a good while anyway, but we'll look into it. So you're walking around then for those next 3 months going, okay. And for me, unfortunately, things kind of got worse, flares and symptoms wise. And I like you have had some, for the first time since my big surgery, kind of, what's that, like 15, 16 months ago, I kind of have like taken to the bed on the odd day, which is so rare. And on weekends where you're just like, if you've nothing to do, you just have to hit that bed, and nothing is knocking that pain. And I'm not a great one for wanting to go down the route of taking the extra strong painkillers, because it's just, you know, I just know some people have had difficulty with that, and I just don't want to go there. But then you're suffering because you're not taking something that probably could help you. But back to my kind of point there, the thing for me was that, yeah, I've spent 3 months waiting for this scan. And the thing that I said most to my family was like, I so want there to be something on this scan. But I don't want people thinking that you want something to be wrong with you. And I think we're all guilty of feeling this, that like, that people are like, God, she wants this drama, or they want this drama, or they want another thing, they want it to come back. You don't. It's just when you're feeling the way you are. And I do believe that you don't need to be a medic to know what your own body's telling you. I just knew something was up. And I don't want it to be back, or I don't want there to be complications. But when I got some scan results only in the last few days, I instantly felt this really weird rush of, yes, thank you, because I knew there was something wrong. And the people who I know love and support me had the same thing. They were like, you knew there was something wrong and you trusted yourself. But the feeling for me was not yes because there's something wrong and that's great. It was yes because now I don't have to feel like it was in my head, or now I don't have to feel like, when I have driven people crazy on days where I have probably, or they've thought, oh my God, she's driving me nuts, you know, like she's still in pain, that now they can go, that was a fair point. And I think that's really kind of tragic for everyone, because suddenly it's not even about your health anymore. It's about what people's perception of you with the illness is. And so from a recommendation point, it's, I need to get that out of my head, and everyone listening, we all need to get that out of our head, because it does nobody any good.
And I think it goes back to the root of the problem of, when, you know, along this whole journey, we were always told we were fine. So we question it constantly. But the other thing, and I was talking about this on a show that's going to come out next month, is if it was MS, multiple sclerosis, or if it was diabetes, or if it was some sort of, you know, I have Hashimoto's, which is an autoimmune disease, but I don't think you can ever really solve it. Maybe you can. I think there's ways to cure it, but I haven't been able to do that. But if it was something that was more well known, I don't even think Hashimoto's is, but like something like diabetes, which is very well known, and there's, you know, if you see someone monitoring their blood sugar or something, you know, you understand. I used to work with someone who was like, I need to always have snacks. And so we all knew, and we all supported that individual, but because we understood what it was, right? So for us, I think it goes back to the lack of awareness, which we can talk about until we're blue in the face, which is the reason why we do this podcast. But if there was more awareness about how severe this disease is and how it affects your entire body, I also think we probably wouldn't question ourselves as much, because there would be so much more empathy and understanding.
Oh yeah, I mean, and again, I'm kind of careful when I use the word trauma, because again, we kind of associate, or I certainly do associate it with much bigger things. And I know some friends, family, and loved ones who've been through incredible trauma. So I kind of feel like, here I am, guilty Elva again, feeling like I have to explain myself. But I think the trauma part is quite true, especially when you've been through some of the more scary kind of acute things that have happened with it.
Mhm.
And like that, what's funny at the moment then is that you've been told so long coming up to maybe diagnosis that things weren't wrong, and you totally believe that. Then when you have your diagnosis, or if you have some difficult times, I think I think this is a thing for awareness. We're still living in this world where people think they find it, they remove it, and it's gone.
Yeah.
And of course, there are cases like that. And we have talked to plenty of people who, thank God for them, they have had one procedure and they've never been bothered again. And
Right.
I'm so happy for them.
Me
It
too.
doesn't happen for everybody.
No.
But what happens is that for those who just, it's a longer journey, or it's a more kind of constant journey, I think what happens is trauma kind of calms and your body kind of blocks it out and your brain blocks it away. And sometimes it is when you're going through something again and you're possibly heading down the journey, not necessarily of surgery, but maybe of other procedures or scans, and it does creep back in. And one thing I'm trying to go and try and work on myself over the next while is to just allow that to come in a bit, because I remember after my last surgery, which was really big and during COVID, I remember afterwards having this thing of like, I can do anything. I could jump out of a plane, because doing that on my own was amazing. And you really benefit from that. And we should all be thinking that we're strong. But it fades, and suddenly the potential of other procedures or other surgery coming back, when you involving things like bowel again and stuff like that, I'm suddenly not feeling so strong. Even when I went for my I was leaving you messages in the car, I went for my CT scan there a couple of weeks ago, and I've had many of these. I've had the contrast drink, I've had the contrast dye injected, and every time, because it had been a while, I sat in the car, drank the drink, and was convinced that I was having an allergic reaction to it. I was like, oh my God, I can feel it. I'm having some sort of allergic reaction. And then when they injected, I was like, yeah, no, I think I'm having an allergic reaction. All in my head, by the way.
Yeah.
And to them, I look like cool, calm, and collected. But yeah, I think the little bit of the trauma creeps back in every time we revisit this. And don't hold that in, because what I'm doing, I'm walking around now and I'm just, well, talking to the world here, but I haven't been sitting at home telling my other half that I'm worried about that.
Yeah.
I haven't told my mom, my sister, who I talk to, are friends, when they go to me, oh, I heard you had some shit news, oh, I said that word. Can you bleep that out on the podcast?
You can
I'm
say
so
shit.
sorry.
We'll
Oh,
put
can I? Oh,
explicit.
okay, sorry. Oops, sorry. Explicit. But yeah,
it's
when
fine. We'll just add the little E, no big deal, Elva. You can drop any swear words.
Blame me, the Irish girl. But no, when I actually was telling a few people about the scan results, I just remember they were like, how do you feel? And I do it. I'm just like, I'm okay. I'm okay.
Of course.
But I'm not.
No.
I've not been good this week. I've had a really just kind of crappy feelings and worries and fears. And I think, again, awareness wise, people need to be able to put it out there that, it's not easy. And maybe, those kind of specialist centers for that they're supposed to be developing, certainly one in Ireland and everything, need to make sure it has psychological support, as well as nutrition and physiotherapy. And I actually think they might have that in this new special kind of center in Ireland. I need to look into it. But yeah, it should be part of your thing, because if you know that basically you're signed on to have something for years to come, I think there really needs to be some sort of support in that. But don't shy away from the trauma, because it's very real. Like you mentioned a few minutes ago, it's pretty scary things happened, and we just kind of recovered physically and went back to work 6 weeks later when you're signed off by a surgeon.
Right. Yeah. Well, it's so true. And you do have to deal with that. It's good to have an endo buddy. Elva and I have definitely, like I was like, oh my gosh, I'm drinking barium, blah, 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 just supporting each other through our scans, even though we're in completely different time zones. We're 5 hours apart from each other, but definitely finding one person or just one support person who really understands it really does help. Even if they can't physically be there with you, at least you don't have to explain all the backstory. So I do have some very good friends who have known me for 20 years, seen a lot of what I've been through, and I'm so grateful for them. But it's very hard for me when they are like, how are you feeling? What's going on? Tell me the update. And it's very hard because sometimes I don't like answering the question how I'm feeling, because we're all trained, like you just said, I'm fine, I'm good, everything's great. I don't want to get into it, but with you, I can just be like, I have this or I have that. And like, you get it, but it's just nice having people who understand kind of the background.
No, it is. And again, they don't need to be experts, because one thing I would say about this is my learning over the last few years has been I've done a lot of learning about the disease itself. And then obviously I've done the learning of my experience with the disease, like my disease, I guess. But everyone who has it, I suppose, is going to have some level of knowledge. And like you say, exactly, it's been really nice when we've both been going for appointments recently, where when I've mentioned certain terminology or certain things to you from like scan reports, you either wouldn't question it back, or you just be like, that sounds a bit sucky. Whereas I've mentioned other things to, again, some of the most amazing supportive people in my life, or when I've mentioned how I'm feeling, and like if one more person tells me just to eat more fiber, I swear to God,
oh my gosh,
I will, because I'm like, I think I am fiber right now. Or if one more person is like, oh, I heard there's this great yoga stretch that opens your pelvis, and I'm like, I've had days recently where I said this to my dear husband recently. Like I had a day where I was like, I feel like I want to take, so this, you should add this to your explicit, but no, I want to take my hands, if I could put my hands inside my body cavity and pull the organs out.
Yeah.
That is like literally, I feel like if I could just reach up in one opening, I would pull things out. And he's so good. He's like, and again, he can't offer anything, but he's like, that is awful. That's what you want to hear. You want to hear someone going, that is awful. Right. What you don't really want is to hear someone go, yeah, and have you seen this lovely brown bread? It's like whole grains, and you're like, oh my God, and I feel bad, because you're just like, thank you.
Have you been eating your greens? Yeah. I mean, I guess
do you drink water?
Our second kind of tip for Endo Awareness Month for, thank you for the feedback, but sometimes we might just need you to listen or say that really sucks.
But what's really funny, you talked about family doctor, and we call that a GP here. It'd be the GP in the UK as well. I don't know what it is in other countries, South African place like that you mentioned. But one thing that's been brilliant for me in the last few years, I've mentioned her on here for anyone who's heard me before, is that I when I came back home to Ireland a few years ago, I had a GP who I would have seen years ago, but on it, I didn't really need to go to the GP many, many years ago, or I went and was told there was nothing wrong with me. But no, when I got back, she was super. And she has been with me now all through, obviously, all of my more detailed procedures with gynecologist. But her own daughter has been diagnosed and has had an excision surgery last summer with a very, very kind of qualified excision, one of the very few people who does excision in Ireland. And it's just amazing how and she said it herself when I saw her recently, her own learning. Like, so when I was there recently and we talked about something else, but I mentioned about pain in my upper right quadrant, which for people is like under your ribs. And I mentioned about this issue that potentially this thing on my liver. And she was like, they've just got to get their head around, this is a whole body disease. And I just was like, oh, I actually admit, I actually probably did have a wee little tear in my eye. And, I wouldn't be like that in a doctor's room. And I was like, I'm so sorry. I was like, I would love more people to hear you say that. Yeah. But she said herself, she was like, I wouldn't have said that 3-4 years ago. So only because she has seen her own flesh and blood go through it. But it is like that. And so again, another point is, again, different countries are different with those family doctor GPs. If you can choose, and if you hear of someone and someone is, they don't even have to be an expert in endo or adenomyosis, because I always think we need to mention that kind of too. But if they even have an interest, because a medical person with an interest in an area is, they're just going to listen more, they're going to vouch for you more, they might look into things more, and so that's one thing for me, is definitely try and get yourself a family level doctor.
Yeah, a base level. And there are, the one other positive thing that I've been seeing with that is, I always talk about access to care, because I feel so privileged for the access that I have, but there's more concierge, I guess you would call it, or like online type doctors that you can pay a small fee and do it virtually without medical insurance. So even that's like another option that I just thought of for people, even just to have a conversation.
And are they all like, are they, it's not to kind of like challenge that, but are they all qualified? Like, are they doctors? Oh, they
Yeah,
are doctors.
they're
Okay.
medical doctors, but they're just working outside of the insurance, I guess, is how
Oh,
it
okay.
works. I'm not really sure, but there's been just more popping up. And recently someone suggested one to me that she thought this doctor would have a really deep understanding in endo. And this is when I was just starting to kind of switch to this new family doctor. And I was like, all right, I'm going to keep this person in my back pocket just in case, because if I go to this new family doctor and I leave crying, like I've done so many times with meeting other doctors, then I'll have someone that is backup. But actually, I went to this new family doctor and she's older. And it was just, we sat down, she started looking through my history and she was just like, endometriosis. She's like, tough disease. And I just appreciated that she said that, right?
Yeah.
And she kind of helped me get the scans to figure out the cyst, and it's pretty large, whatever. And she was calling me once a week, or someone from the office just checking in. And then the last phone call was really like, you really need to talk to your specialist, because we're at the final, we don't know what to do for you next, but we're here. Like, you call us if you need local support. So even just having that, and then
no, it is, because there are the other things you need. Like I now know, for example, knowing that now I think my doctor would have respected me and always respected that if me as the kind of patient I am, if I came to her and said I'm in pain, she would have believed me and wouldn't have maybe had any concerns. Because I think, you know, without getting too deep and dark, there's a huge concern for a lot of illnesses that are chronic with people in pain medication. And so it must be really, really hard to be a physician and responsible for prescribing and then being careful about prescribing. But I kind of feel with her, she would always have said to me, like, you're not going to come in here saying you're in pain when you're not. I think it's visible anyway in your face. But I think even more so now that she kind of is understanding this more. And like I said to you, so she said she's kind of on the train of thought that it's a full body disease. But she anytime I talk to her, she uses the word sneaky. And I really like that word, sneaky. I'm like, it is sneaky.
It's a sneaky disease.
That's a sneaky little disease. And she was just like, it's really sneaky. But I kind of feel like if I was in really quite bad pain, which I have been in the last few weeks, and maybe I should make that phone call the next time it happens. Maybe I do need something a bit stronger, and just to trust that she will only give me the number of doses or days. I have a bit of, and I guess I think it's a valid thing to talk about. Like, is people have some concerns, especially if you come into something like endo and maybe you have a history of having some difficulty with that, or you've had family history or friends history. It's really valid to be worried about having an illness that from time to time can require a lot of pain assistance. And it's working through knowing your own body and your own level of what you can kind of take to keep going normally. And like that, if you're getting to a point where you're like not standing up straight or you're taking to the bed, I mean, you probably should get a little bit more help, because you're no good to anybody. But then all the more reason to get that you trust a doctor, to don't try and go mixing stuff and taking stuff yourself. It doesn't it's one of my biggest fears, and we've talked about that a lot. I've often said to you, like, funny thing, like, I need to go out, I need to do this today, and you're playing that game of, do I take something strong, because let's be honest, I still want to have my life and I want to have a glass or two of wine, and you want to see your friends and not be the party pooper, and you're going, I just don't want to mix that stuff. And you know what I mean? It's just being really honest with yourself and realizing that for me is where you realize it's a whole lifestyle thing. It's not transient. You know, you kind of have to be aware of what that is. But anyway, that's just my tip there.
I mean, I agree. Like, you shouldn't be embarrassed to take pain medication. I think if you need it, you have to take it. And there is a taboo around it. I completely agree with you. I personally, I mean, I used to take copious amounts of Advil. I think everybody on this podcast has heard me say that. I mean, way too much, which is ibuprofen, or what do you call it there?
Ibuprofen. Yeah. Which you've got to be really careful with your stomach.
Because your stomach, and I had no idea when I was like through high school and college, you know, I was just eating those like candy, you know, and it did help. I mean, it just took the edge off. I never was out of pain. And then once I was prescribed something that was more serious, on the really bad days, I would take it, and just to get up, to be able to stand. I've shied away a lot from it now because I'm very sensitive to pain medication. I don't know if that's from endo. I don't know if that's from taking too much Advil, but like I cannot take a full dose of anything because it just will knock me right on my ass. Since we've already swore, let's just add all the swear words. But I wanted
Ass
to
isn't bad.
mention, yeah, ass is fine. Shit is fine. Really going down a different road. Like we told you, this was going to be a
Wing it podcast.
winging it. We're winging it. I like to wing it sometimes though. But I wanted to mention that I finally was able to get into the GI doctor, so the gastro doctor, because I was worried. And the experiences I've had with GI doctors in the past have all been poor. And the last one I went to, I did leave crying. And I remember posting a picture on Instagram. I was more active there. And I got to my car and I was crying and I had to go to work after because he basically told me that there was no way that endometriosis could affect the bowel and that, you know, my nausea wasn't from endometriosis. And I don't know why it made me cry. I should have just been strong, but I didn't feel good. It was just not in the right headspace to hear that. So this doctor that I saw recently was recommended to me and I went, and I am nervous going in to see these doctors. He sat with me for about 40 minutes. We talked through everything. We talked about my surgery. We talked about the endo, all of it. And at the end, and I almost started crying because he said this, he said, "You've really been through a lot." That's what and I was just like, I don't know why, but I feel like I needed to hear that. Maybe not even from a doctor, but just from a person. Like,
well, but do you also think, I think it means more when you hear that from someone who actually has that full awareness of it, because actually, and this may be the way my head works, you'd maybe expect more that because they speak to people who have loads of illnesses all the time. I kind of expect sometimes that, say my doctor would just be like, "Oh, you've been through it all, but like, so is the last person who came in to see me, and the next person in 10 minutes. And so I think it means more to us when someone who is kind of highly active in that medical field, for them to take that time to say it and to believe it. Because again, it's back to this validation. It's making you kind of go, yes, I actually have been through a lot, and I don't maybe stand up and say it enough.
Well, and he was like, "How many surgeries have you had?" And I was like, 7. And I said, "I'm not I said, I promise you, I'm not like seeking surgery." He goes, "I know." Like, it was me. It was like, I was the one who felt like it all goes back to the confidence. And he was like, "Yeah, I know." And I was like,
it's so funny though. Yeah. Thank you. I was actually speaking to a friend of mine overnight who is expecting she has endometriosis, although hers was discovered accidentally, incidentally, however they refer to it, when it was so for some fertility issues, and she is expecting her first baby after many, I'm talking like 10 years, and baby should be here in a few weeks. But what's so funny is that she'll be induced a little bit early, and she has to choose now between being induced, or sorry, she's deliver a little bit early. She has to choose between being induced or having cesarean. She said that the doctor said to her, "Because of your extensive surgical history," and she said, it made her sound like, I was like, you made her sound like some sort of like addicted to plastic surgery, like some, I wasn't going to say a member of a celebrity family here, but like people who are just in like tweaking everything, like they're going to the supermarket. And she was like, "Yeah, I was kind of nearly offended when he said I'd go cesarean," but what he meant was she's had quite a few procedures actually on her, I think around her uterus. And I think in terms of inducing her, and it'd be interesting to know actually other people listening who have had endo and maybe procedures and then natural births, because I think sometimes there's a bit of an issue with your uterus contracting normally through labor or something, if you've had scar tissue, because you've had, again, maybe she had ablation and there may be scar tissue on and stuff like that. I don't know. But anyway, he kind of was like, "Look, it's up to you. I'm certainly not worried that you wouldn't have a natural birth, but I'd probably go cesarean because of your extensive surgical past."
My gosh.
I was just so funny. I was like, "You're hooked. You're hooked."
I agree with her though. If she was like, I feel like I would feel a little offended, and I get it.
Like you were queuing up, like, next year I'll have this, and then I think next year I'll have this out.
Right. Like, yeah, just,
Or like 3 for
It's
2. You're like, do I get the next one free?
yeah, right. Right.
Yeah.
I know. I know. And Elva and I have been chatting about all of the words. What are the words? Scanxiety. We
Scanxiety.
didn't invent that, but scanxiety
Yeah.
is a thing. And I
That's a
think
huge thing in, I think, for a lot of cancer patients, because they have to have so
yes,
many review. Yeah. But you
yes,
do
yes.
get it.
Yeah,
And
we
that's
get
not
it.
linked to being worried about having an allergic reaction to something you've had many times. It's
I
just
think it's
being
the whole
nervous about
thing. I think it's the scan. I think it's the results after. I think it's the, is something wrong? Is something not wrong? There's a whole,
Oh, and also I think as well, and I suppose I am. No, I don't think I'm a hypochondriac, but like I would be a thinker. But I'm also thinking as well, get the best value out of this CT scan. Like, just
get
in
it
case
all.
just in
Right.
case there was something else in there. Like I was telling
Exactly.
you, I have my images and I'm such a nerd. I look at them. And I mean, I've become a little au fait with reviewing CTs and MRIs, but I did the other day was like desperately Googling what this one particular space on a CT in your abdomen looks more like. And I was like, no, I'm telling you, that's wrong. That's wrong. And it's the color. And I realized it's my stomach.
Oh my goodness.
So I have a stomach, which is good. But no, the scanxiety is definitely there because you're just, and yeah, as I said earlier, then it can be reversed with this amazing feeling of like happiness when they do, because you're just like,
You feel
finally.
validated, but then it's like
Yeah.
you don't want something to be wrong. I know.
No.
It's
Yeah, it's a
crazy.
weird one. Explain that one. Psychologists figure that one out. What was the other one we have talked? You got that was pain somnia for you. That was good. I thought
Oh,
that was
I have
clever.
pain. So because Elva's 5 hours ahead, it is very convenient when I
Yeah.
wake up at 3 a.m. in pain, I can just message her because she's awake. So
Awake.
I messaged her and said, I'm having some pain insomnia right now. Also, we didn't coin that phrase, but I've seen it before. And it's a real thing where the pain woke me up. And
Yeah.
then because I was in so much pain, I couldn't go back to sleep.
Yeah. It is. A pain should never, I mean, and just coming back to some like headline stuff with endo, like you should
Yeah.
never be woken by pain. I've been being woken by rectal pain again lately. And
Yeah.
that is just, and again, it's embarrassing, even it's, because, and seriously, I always have an issue with this, the rectal kind of stuff with endometriosis. And I do think that's a bit of trauma from some of the things that was suggested to me when I was first experiencing that. And I mean, I won't even repeat them, but like some of the stuff doctors were saying, like, could be wrong with me or that I was doing in my life that might be causing that. I was like, I'd tell you if I was,
Right.
popping things in there, and or like had I damaged myself. No, I'm literally being woken in the middle of the night with this incredible, like someone is stabbing you, but that's back. And that was always really scaring me lately. I'm like, why is that back? And I've tried everything. I do like the massage, I do the ice cubes, do it all.
I mean, you're
and that sets
justified
in.
in feeling fear with that. I mean, that's it. First off, like you said, it is embarrassing and it shouldn't be, but it is. Nobody wants to talk about rectal pain. It's not like you're going out to dinner with your friends, be like, how have you been? Oh, I've been having some rectal pain. How about you? Oh,
unless you're out for dinner with you.
well, yeah, then we could talk about it all night.
Table beside us might not be happy, but
they would be like, can we move? We don't want to eat.
Could you keep it down, please?
But that, like, things that people don't think about with this disease is it just can affect so many other things that make it much more scary. It's all scary, but like a lung collapse is terrifying to me.
Yeah. Oh my gosh.
Losing part of my bowel was horrifying and terrifying for me. You also having a major bowel surgery, terrifying, but it's all so, it can be so scary. It's just the people that don't understand how it can affect other parts, they just think, oh, it's just the uterus and the ovaries. It's not.
Oh man, I told you about that book I was reading. That's such a good book. There's a plug.
Tell us about it.
So it's not an endo book, but it's called Unwell Women by Eleanor Cleghorn, and I hope I'm pronouncing her name right. I can't remember. I just saw a post on Instagram or something, or I think maybe I heard about it on the radio. It's such a good book. And it's probably, I mentioned to you because it probably is a really good book for listening too.
Yes.
But it's the thousands of years of that societal thing about women and women's health. And comes right up through the ages of, and I mean, it's right back to like the Greek and Roman times, and very, very clear evidence of how women's health, how women, just their bodies were considered. But I mean, it comes right up to the modern day times of it being not too long ago when women were only just introduced to clinical trials. So, you know, a huge amount of our medicines and our medical research has been based on male only bodies. But no, it is a brilliant book. It's really worth a listen, or a read, because yeah, we've just been kind of, I don't know, like kind of, I don't know, what would you
Dismissed.
say? Yeah,
Dismissed.
dismissed. Yeah,
Dismissed.
and not even that, but like how it's carried through, like even to modern day medicine, about how they apply these general rules, and that you know, it's not considered different. And even just the whole like hyster, because that one always gets to me. It is true that
Yes.
hyster is the word for uterus, is the Greek, and so the term hysteria, when it used to be classed as a psychiatric condition only related to women, and it was
Yes.
deemed that it was linked to having a uterus. So that's why I actually really try in my life now to not say that someone is hysterical. And if I hear people say it, I'm like, stop using that word. but
That's
yeah,
a really good
read.
point. Yeah, I did download it. I'm gonna listen to it.
Yeah.
But that's a great book recommendation. And I mean, we've talked about the gamut of things and what we've been going through, and I appreciate your honesty and vulnerability, and I hope you feel better soon. I mean,
Mm,
in this endo month, I mean, really, if you are suffering and you're in pain, know you're not alone. I think that's such a
mm,
big point, and so many people are either just starting to figure out that they have endo or that they have it, but they don't know where to turn next. And really finding the community and people in the community is very, very helpful. And then just doing loads of research. You may not want to, but that is something that really has helped myself. I know, Elva, it's helped you.
mhm.
Reading actual, I mean, you can go to Google Scholar and actually read. That way, you're not getting to like blogs and things that may not be
No.
100% accurate. But Scholar, I mean, if you want to go down a rabbit hole of reading medical papers, but you can read just the lay summary or the abstract or something
Yeah.
and learn more. That's where I
Yeah.
started.
Yeah, it is. And I think, look, the other thing to note is that, because you'll definitely have people listening in who, we've said this before, are sometimes maybe terrified by their future when they hear some of the patient stories you've had on, or say mine and yours, where like there has been multiple, procedures and or multiple kind of treatment approaches and medications and all that kind of stuff. That's not the case for everybody.
Yeah.
But it doesn't mean that your experience isn't valid. Like listening in and being like, oh, okay, well, thank God I'm not like that, or thank God I will never get like that, shouldn't take from the fact that you still have this, or have, or potentially have it. Just don't let yourself go down the rabbit hole of thinking, Jesus, am I going to end up losing bits and parts of me that I want to keep?
Right.
And
Right.
am I going to have, like, like that from the fertility end of things, struggles, or how long will this go on? I guess it's just build your awareness, read, but don't be too terrified, because I think actually the more awareness that's out there and the more specialist doctors out there, hopefully people are going to get diagnosed at least some years sooner than the likes of
Yes.
yourself and myself, which really should knock on the head, hopefully it getting so deeply infiltrated into other organs. That's my hope anyway, is that
Yeah.
it'll become more rare for you to hear from people in years to come who've had to have such extensive surgeries, because actually it was like my GP, my doctor's daughter. She's had an excision at 21, 22. Amazing, brilliant,
And
because
that's what
she's,
that's
yeah.
what the awareness is all about. And I recently spoke with someone who has two daughters and has endometriosis, but she will now, as more information, she will know what to look for at a younger age,
Yeah.
at 10, 11, 12, 13, because she now has the awareness that she has the disease. So I feel hopeful. I feel hopeful for early diagnosis, and wishful that to get diagnosed. You don't have to have a surgery. I mean, those are
Yeah.
things that I'm hoping, when I reflect on Endometriosis Awareness Month, and if you're looking for ways to help or get involved, obviously you can email me if you'd like to come on the podcast. I have a couple slots left for this year, but telling your story, if you feel comfortable, even if you don't want to share it all over social media, I 100% understand that. Or if you're not on social media, but telling a friend, telling a neighbor, telling a classmate about what you're going through could change their life, not only because you're giving them the awareness, but they may know someone in their life that potentially could have endo. So if you're looking for ways to get involved, I always think the first step is sharing your story. And if you are not a patient, supporting charities and just listening and being empathetic and learning about the disease, because the more people that understand it, the better the awareness will be.
Yeah, that's a really good point. And don't keep it to yourself, kind of have it out there. I'm probably not great at oversharing, but again, that comes down to
well, you just talked about your butthole on a podcast. Pretty sure that was enough sharing.
That's not funny. When I come on here, you see, in my head, I just think it's you and me, and maybe like 4 people in like rural, Dakota, or I don't know, some random size. No offense. Dakota. Is there rural Dakota? Is that a place? Would it be
2 Dakota states? Yes, South Dakota, North Dakota, and they have some rural area.
Okay, well, rural Texas or I'm Irish. We'll think of like Kansas or somewhere like, the Wizard of Oz. So yeah, or there might be someone in very rural Ireland. And I'm just kind of have this vision that they will also be people with it. So they're like, I'm not going to tell anyone what that girl said, but maybe the whole world will hear this and they will know that but I don't mind. Actually, I don't mind. I think I've gotten past that point, because if I think then that someone can go, if she can be weirdly lighthearted about it, but really true to it, then I've helped someone, and maybe they'll go, I need to tell someone about that pain that I woke up with the other night.
Yeah. What you've experienced is not abnormal.
No, it's very common with it. That's
common.
What I'm saying. People are probably going into doctors' offices,
taboo,
and they're just talking about the cramps and the periods and heavy bleeding, and they're afraid to go, but I got this pain in my butt, because they're thinking that's got nothing to do with it. It very much does and can.
Yeah.
Pain in your ribs, pain, anything. We may as well call a few other things out. Anyone's having anything that involves blood at that period of time, coughing it up, throwing it up, anything like that, like you would never think that was anything to do probably with your cycle.
Right.
It very much is. Again, I'm not trying to terrify people, because that's very rare, but like, be aware. And also, if that happens, it doesn't mean that it's also the end of the world. You might not even need to have a big surgery about it, but they can do other things. So bring all of those symptoms out. Everything you think, I don't know, funky looking toenails, just tell the doctor. I don't think you can get funky looking toenails from endo, but yeah, just list everything. Don't be afraid. Yeah.
Track your pain, track anything that seems off. And
you tracking your pain, Melissa?
No. I started, I was good for like a couple of weeks. I'm a hypocrite.
Oops. Yeah, we're total hypocrites here. Tell the doctor.
Anyway. I know. I've been better, but fall off. But yeah,
it's hard though, because you're trying to just live your life. Like, I'll finish this now, and you go downstairs and you think about dinner, and you just got to get on with your day. And people have families and people have everything. So don't, it can't overcome, it can't take over. And if it does, that's a problem too. So try and I like to try and compartmentalize and give it some time nearly of the week. So if I was going to talk to you today, I was like, right, I'm giving it a bit of time today. And then hopefully the rest of today, it just doesn't consume my thoughts, because otherwise you can get down.
Yeah. Oh, 100%. 100%. It is very challenging, and I try to do the same thing, but it's just a chronic disease. And, we're in this together, and we're all here to support everybody. And there are a lot of people that have had this disease that, like you said, have one surgery or they feel great. So there's so much hope, and there's a lot of potential to feel really well. And it's also about giving yourself permission. Like you just called me out for not tracking my pain. I tell people to do it all the time, but I needed you to do that because I need
Yeah.
to do it, right? Like it's
Yeah.
important to do, and any symptoms. But what I always end with saying is trust your gut, trust your
Mm.
intuition. It's always right. If you feel off, if you feel like something's wrong, if you know something's wrong, something's wrong.
Yeah.
Don't don't deny it.
Yeah. Yeah, and they say that too with medical fields now. Like if you have chest pain, don't deny it. Don't sit on it for 5, 6 hours. Trust it. And yet,
Yeah.
then people feel again. Read the Unwell Women book, because with loads of other illnesses, they're like, prostates and loads of men's thing. They're like, trust yourself. If it's not right. And yet, for whatever reason, when it comes down to some shit, women's health, the first thing they'll go for is, you stressed, family busy. They seem to always want to go for that. Got a lot going on, migraines. Yeah, don't no, and just and start bringing it up, saying thank you very much for that suggestion. However, I would also like you to consider this, please. And the
I
other
mean,
tip is
yeah.
the last one. I'm not inventing this, but I've just seen this a lot, and it will take a lot for me to have the bravery to do this. But there is a tactic that a lot of people use now, where if you are frustrated that someone is not taking, especially after a second time, and you've asked for a specific type of test, they can be expensive, but if it's valid and you feel it's valid and you've asked for something to be investigated and they will not do it, just ask them to put on your records that you asked them to do this and they refused. They don't like it. And I have friends who are doctors, and I don't mean we're starting to get like legal about it. It's just saying to someone, okay, that's great, thanks. I think I really would like to have another ultrasound. So, and you just don't think it's really valid right now, but can you just say that in February 2022, I asked you for an ultrasound and you said it wasn't warranted. So that, next year, and I guarantee you something will get done, because they're not going to want to put that down. So
That's a
it's a hard
really
tactic, but it's a good one.
hard. It's a very, very good tactic. That was a very helpful tip. And I don't think I've ever done that, but it's a really good one. I mean,
They'll be like, I'll be blacklisted in all these hospitals around the world. That
like
lady who told
Elva,
you.
not allowed in any of the
change
hospitals.
change my name.
Well,
No.
I think we've come full circle from what we even started at the beginning of the show. And it's just, you have to be assertive and advocate for
Yep.
yourself. It comes up on every show. And
Yeah.
should it be that way? No. Is it that way right now? Yes. And it's a fight. It's an uphill battle. Elva and I recently had to fight to get imagery on a CD disc, which most people can't even play anymore. So like,
No.
it's just, there's so many little intricacies like that are just, a
Yeah.
struggle on the daily to get the care you deserve, but you have to do it. And if you have to step away from it because it's too much take a day off and then come back to it the next day. But if you're really in a lot of pain, you have to keep fighting. You have to keep pushing. And what's that famous image of the guy pushing the rock up the hill? Like that's what I don't remember what it's called. It does have a name, but I feel like sometimes that's the struggle with this disease, is you're constantly, you're moving up the hill very slowly with this heavy weight. So but I am hoping that everyone who's listening is feeling okay. And in this Endometriosis Awareness Month, thank you so much for supporting the podcast. I can't believe this is year 4. And without your listening and sharing this, we wouldn't be able to help more people. So thank you so much, Elva. Thank you always for being here and being so transparent and honest and
to my own detriment. But no, you're welcome. Thank you for having a platform where people feel they can do that, because I think that's key to you and your interaction, is that people get on here and probably can't believe how open and honest they've been with someone. So thank you for enabling that.
I just like to provide a space. It's really all the heroes who listen and have been here. So thank you for everyone. Endometriosis Awareness Month. Spread that awareness as much as you can and feel comfortable. Let's, do what we can to get a cure for this disease. Thanks for listening.